the latest generation. This is the latest generation of the PET scanner. The front portion is what is called the CT. The back portion is the PET. Patient will lie down here.
Anything else you thought I have missed? So which is might be important to go to the media so that the
Yeah, the
masses
thing
know about
is,
this.
not everywhere else in the world, only one type of a PET scan happens, that is called as FDG. In this machine, we can detect various types of methanols. We are deciding which particular PET scan is needed for that particular patient. Because all cancers are not same. All of the cancers do not benefit by FDG PET alone. So you saw it in the radiopharmacy. There you will decide what molecule I have to be injected. Take the injection, come here. The beauty is now, earlier they were doing for almost 1 hour waiting period and it was taking about almost 45 minutes or so. Now because the uptake is so fast, with the new generation, new isotopes, we can finish the scan. We can start the scan within 20 minutes. Waiting period for the patient has come out. Start the scan within 20 minutes and by 30 to 40 minutes from the time of injection, the patient is out. And then 10 minutes later we can start reporting also. It is that fast. Thank you.
2, 1. Ladies and gentlemen, there we go. You can cut it now. There we go. Now, ladies and gentlemen, right now we'll proceed on to unveil the plaque. We will proceed on to unveil the plaque. So I'm going to share. I'll ask you to come this way. This is that. And we'll come this way as we officially unveil the plaque. So you'll be able to hold the plaque on this side. So our executive chair, Sabachu as well. You will, so we'll count in 1 street each. So you will hold this other side. So there we go. So we'll pull it together. 3. So you can pull this side. Beautiful. So 3, 2, 1. Ladies and gentlemen, there we go. There we go. Beautiful. 30 seconds to take the pictures together. Please a round of applause for this amazing. It's officially open. Now I think it's time for us to officially get it. So we'll ask the two of you sirs. So we'll stand on either side so that we can take a picture. So that we can.
All the distinguished guests and my friends, it's indeed an honor to be here. Mainly because, as you know, the history of this cancer center belongs to really Dr. Adamal for what he has done. And without his vision, he's a visionary. How he started the oncology center, how partnered with Mr. Vichu Patel and his family. Wonderful vision. The base was set. But as Dr. Adam Ali said, challenges were faced. And what we in HCG specialize is in challenges. We love challenges. So when there was a challenge, it was easy for us to say, as we know most of the hospitals which come from India, without naming anyone, are there to lure patients to come to India. It is financial, they use touts, intermediaries, everything. And the main thing is, if you think the patients are beneficiary, yes, but they also go through a lot of turmoil, getting a visa, coming to India, unknown place, staying, and a lot of them come with advanced diseases. This is when I went against the grain. And when Dr. Adam Ali came, I said, this is what we have to do. For me, I consider myself honestly a global citizen. I was in US for 25 years. Left, came to India to make a difference. Similarly, I said, I may be Indian, but I'm global. And definitely East Africa needed an advanced cancer center. And we were very fortunate also to work with MP Shah Hospital. Dr. Tasim Din is here. Thank you for coming, Tasim. And we really want to work as collaborators. And they have MP Shah also as a vision to bring highest possible care for this part of the world. And in oncology, which is so specialized, I know today evening we are having a long discussion, but I just want to say every 3 months oncology care is changing. Every 3 months. Precision oncology. It is very difficult for patient to do online or patient to go to India for a short time, spend enormous amount of money and away from family and to get treatment, and we don't even know what will be the outcome because of the magnitude of the issues and problems. So what is the best thing to do? Bring the center of excellence here only. And that is what we have done, and that is what we want to do. With your cooperation, we can do it. I think we should take pride in doing it. Not sell the patients, come to India. Yes, there may be a reason, there may be times for certain things, but majority of the people should be treated here. That is where they can get the best of care, provided we have the center of excellence. Long time ago, just to give you a parallel, when I was in US and trained at MD Anderson, center of excellence was US. But in a short period of 10-15 years, we have brought the Indian platform. HCG has been a trendsetter, and we are a Harvard case study 5 years in a row because our quality of care is unmatched and equal to best of centers in the world. We have achieved it from nowhere. And let me promise you, dear friends, we can achieve the same thing here. And for me, we love Kenya. We think people are wonderful, people are so good, and the weather is great also. Okay, so we can. And the only thing is we have to come together. Not have doubts, issues. Trust is an important factor. If we trust each other, I would promise you one thing, and for my whole team, Upendra and the whole team, money comes and goes, but we want to do right thing for the patients. And that HCG promises to do. And what I want to say, we have stalwarts like Mr. Bichu Patel, Adam Ali, and their families. It's everyone who are dedicated to this, to bring that quality of care and excellence here. This is only the PET scan launching. We did the LINAC launching few years ago. We brought the highest possible linear accelerator in the world. Dr. Adarsh is here, who superheads it. We brought it. And we will continue to do that. We do SRS, SRT. We do highest possible care here. And we want to continue that. And PET scan is a great addition. I always felt, I remember the days when the first PET scan came to US. First PET scan to US. Mesmerizing, molecular. I can actually detect a single cancer cell, where it is. It's amazing. It was as big as a big football field, cyclotron. Not big. Now we have brought it smaller. As you can see, cyclotron is not there. We don't even need, as Dr. Kallur said. So with this advanced technology, I join you all on saying we are proud we are able to deliver this with lot of hardship. Yes, hardship is always good. Hardship teaches us lesson. So with this, we have achieved this. And going forward, I like to promise one thing, that we will be sincere. We work closely with our colleagues, closely with MP Shah Hospital, which has been very cooperative, closely with all our doctors, colleagues in this part of Africa. And I want to work hard, whether I succeed or fail, I'm not sure, work hard to make this center a center of excellence, a comprehensive cancer center which provides equal outcome as best of centers in the world, or even maybe better. With this promise, I want to conclude. Thank you very much for being here. Thanks a lot.
Ladies and gentlemen.